Hi there, and thank you for joining us at CES 2018. We're coming to you live from the Digital Health Summit booth presented by United Healthcare. And today we've got Thomas Riley, who's the president and CEO of a fascinating company called SeniorLink. Now, SeniorLink is very, very interesting. I've heard a lot of different digital health companies, and the attitude is just patient-focused, patient-focused. But when you think about healthcare, especially in the United States and beyond internationally, caregivers and the family around them is oftentimes the healthcare quarterback, not someone who's hired by an institution. So how do you guys at SeniorLink, how do you think about caregivers and their importance in the family relationship and in the health relationship?
Well, thanks, Derek. Great question. So SeniorLink marries collaboration software with care management strategies to support caregivers of really complex individuals. We do that on behalf of both government and managed care payers in the US. Probably not known to you maybe, there's 40 million family caregivers in this country, 12.5% of the US population.
Wow.
And the RAND Corporation has sized their effort at $500 billion of unpaid caregiving.
Holy smokes.
If you think about our $3 trillion healthcare system, if the caregiver wasn't taking time off from work, picking mom up at the hospital, buying, reconciling, administering the meds, doing the care coordination, we wouldn't be spending $3 trillion, we'd be spending a lot more.
That's just mind-blowing numbers to think about. That's the reach that these unpaid caregivers are submitting. And there's a second, really kind of a follow-up question to that, is that now all of a sudden government is moving. There was a bill approved yesterday that puts the clock on Congress to figure something out about these caregivers. Could you tell us about what you guys at SeniorLink are looking for out of this next legislation that's going to help empower those caregivers, hopefully?
That's great. Very timely question. The RAISE Act passed Congress Monday afternoon. It's on the president's desk.
Yeah.
And it gives Congress 18 months to come up with a strategy for family caregivers.
Yeah.
This is vitally important because if we don't incorporate the family caregiver, if we don't give them the tools they need to do the important work to support the most costly members, 15 million of the 40 million, as an example, support members with dementia in the community.
Yeah.
So if we don't empower them and give them the tools and resources necessary, there's very little we can do with benefit design or incentives to change the cost curve in healthcare.
Right. Well, I think we're about at time, but thank you so much, Thomas, for joining us. You guys are doing incredible work, solving a problem in the market that not very many are going after and solving. And so good luck to you, and good luck on the continued fight for caregivers.
Thanks
it's exciting
very much.
to watch you. Thank you so much, and thank you guys for joining us at CES 2018. We're live from the Digital Health Summit booth presented by United Healthcare.